Ogbewe. Also this Wednesday at 10 a.m., I will be visiting the Josiah Henson Museum and Park for the Underground Railroad Month 2021 launch event. This is a month-long recognition that acknowledges the significance of the Underground Railroad and its contributions to the eradication of slavery in the United States. It also encourages the public to travel to Underground Railroad sites to learn the history associated with individual sites and experience the local, the regional, and the national stories of the Underground Railroad. Third, as many of you know, the three major bond rating agencies reaffirmed our county's AAA bond rating for 2021, which is the highest credit rating available for a local government. This rating helps us save $15 million in interest rates, and it reduces our annual fees. I was happy to meet with each of the three rating agencies a few weeks ago and to share with them some of the new fiscal policy that the council put in place this year to strengthen our response to future emergencies like the one we experienced over the last 2 years. The rating agencies were very glad to hear that the council updated our fiscal policies to ensure that the county always replenishes our reserves within 3 years of a recession or a national emergency if our reserves dip below our policy level. We also updated and prioritized our one-time revenue policy to focus on reserves and other long-term liabilities like OPEB and pension funding. Protecting our AAA bond rating is a momentous announcement for the county and is a testament to our resiliency. It proves that with hard work and commitment to fiscal oversight, we can weather even something as economically devastating as the global pandemic and the crippling recession we have experienced over the last year. So I want to extend a special thanks to the entire council, the county exec, the GO committee in particular for all their hard work this year, and especially to GO Chair Nancy Navarro for her expertise and her leadership on fiscal responsibility. This is actually the 49th consecutive year that Montgomery County has maintained this prestigious rating, so we'll do everything we can to earn this rating again next year. Fourth, the council, acting as the Board of Health, recently passed a regulation urging the county exec to work with our employee organizations to implement an employee vaccination and weekly testing plan. We requested the county executive provide an implementation plan that will require all county employees who report to work at a county facility to either be vaccinated or provide proof of a negative COVID-19 test each week. Now the system has been implemented. Last Wednesday, the system went live for the first time, and employees received a message regarding the disclosure of their vaccination status. Employees will have until September 18th to complete the online disclosure form, and on September 27th, first notices will be sent to unvaccinated employees needing weekly COVID testing. So this is an important step, keeping our county employees and residents safe. I'm grateful to our public health team for pushing it forward, and I encourage all of our county employees to get vaccinated if they haven't already. Fifth, the council vice president and I were thrilled to join acting superintendent Monifa McKnight and board president Brenda Wolf, the county exec and many others this morning to celebrate the reopening of our schools at the recently renovated and expanded Seneca Valley High School, the largest school in the state. I brought my kids to their school this morning and to their open house last week. Like probably all MCPS parents, I share our community's excitement and apprehension about the new school year. So I want to reassure all families the county council will continue to work closely with our school system to support protocols to keep all our kids and our school staff safe as possible. We've had an excellent partnership sitting as both the Board of Health and the funding body of MCPS, working to provide the support needed for a great school year. Health and safety are our top priority. We are grateful that MCPS is requiring the use of masks in all schools. They'll be using enhanced sanitation, improved ventilation, and requiring all their staff as well to be vaccinated or tested weekly for COVID-19, among other measures. And I've urged MCPS to consider requiring all staff to be vaccinated unless they have an exception. Another school priority I shared with Dr. McKnight and the school board was ensuring all schools have an outdoor lunch option. I'm very happy that Dr. McKnight made clear last week her expectation that all schools would make that possible. And I advocated to Dr. McKnight and the school board to host virtual back to school nights at all levels and virtual outdoor open houses at the elementary level due to the significant rise in COVID-19 cases around the county and the state. I attended our outdoor open house at my kids' school last week. It was very hot, but it was great to see people in person and see everyone in a safe place like that, taking additional measures to keep everyone safe. MCPS will be providing COVID-19 testing for students in pre-kindergarten through grade 6. A random sample of students will be tested each week, and families will need to opt in for the testing. So I urge everyone to sign up online now. The more students who participate, the safer all classrooms will be. And I hope MCPS eventually moves to opt-out testing, as DC public schools have done, to increase participation. Finally, on this topic, as many of you know, I've been advocating to add social workers to our schools for about 8 years, a need that has become even more urgent during COVID. I had even prepared a special appropriation last spring, so the hiring process could start this summer, but was asked to wait for the County Executive School Safety Work Group to make their recommendations. Obviously, school started today, but there's still no report from them. So I very much appreciate Dr. McKnight's agreement on this need, and our close collaboration is coming to fruition now. MCPS has announced they plan to add 50 social workers to the ranks of their staff this fall using federal relief funding. This is a much needed initiative. Our returning students have been dealing with grief and loss and isolation and anxiety for 18 months. And we know we have widespread undiagnosed behavioral health needs. So it's a relief to know these social workers will be available this fall. I wish they were all in place today. I'm grateful that we'll continue to partner with our HHS department and the school system to provide vaccination clinics as well. I hope you'll join me in sharing a photo of your kid's first day of school and email it to the PIO at mcpsmd.org or post to Twitter with the hashtag MCPS First Day. We always have a good time taking that first day snapshot to celebrate the beginning of another year full of new experiences and learning. And finally, I want to just give a shout out to Dr. Gales. The news of his resignation was a surprise for all of us, but I really want to take a moment to thank him, since he's here with us this afternoon, to extend our sincerest thanks on behalf of the council to him for all of his hard work, his long nights, his dedication to our residents, especially amid the pandemic. Dr. Gales was instrumental in helping us save many, many lives over the last 18 months. He's always provided the Board of Health with terrific up-to-date information and recommendations to keep our public as safe as possible. We're all incredibly thankful to you, Dr. Gales, for your efforts. We'll miss you greatly, and we wish you all the best in the next phase of your career. So with that, let me turn it over to Vice President Albornoz.
And I'll be brief so we can get to the COVID report from Dr. Gales and Dr. Bridgers, but I just want to echo your sentiments about Dr. Gales as the chair of the Department of Health and Human Services. Even prior to COVID, Dr. Gales had demonstrated tremendous leadership and vision in helping to establish a much stronger infrastructure of public health here in Montgomery County, the likes of which was tested in ways we never could have imagined. And he has put together an impressive team that I know will carry on the torch, and we wish you nothing but the best, Dr. Gales, and appreciate you so much for your steadfast leadership, not just during the pandemic, but before that as well. And I'll just make one quick note, Mr. President. On Friday night, you and I and a number of our colleagues had the opportunity to visit the Summer of Peace event in Germantown, which took special meaning because just 1 week prior to that event, a 20-year-old young man was gunned down senselessly with his 17-year-old brother also shot, and his younger brother witnessing the entire incident. And of course, a 14-year-old has been charged in this senseless crime. And I had the opportunity to visit, as a number of my colleagues did as well, with his parents. And I just want to extend my deepest condolences to them and honor the commitment that I know everyone that spoke to them that night and will be working with them moving forward, committed to, which is doing everything that we can to prevent senseless violence like this from happening again in the future. For me, it was especially personal because it happened on the campus of the Plumgar Community Recreation Center, a department that I proudly served as the director of for 12 years, and a ribbon that we cut just 6 years ago at that facility. And we have to double down, triple down on providing more meaningful and gainful after school and summer options and programming for our children and youth and families, but also address the pervasive issue of gun violence in our community. This was the first murder in Montgomery County that had been carried out with a ghost gun. And my hope is that it is our last. But we need to continue to coordinate with our federal government and our state to enact more legislation that builds off of the legislation that we enacted here on the local level as we try to fend ourselves from this new and emerging technology that obviously now we know has tragic consequences. So we will have to redouble those efforts as well. So with that, Mr. President, I yield back to you, and I look forward to hearing from Dr. Gales and Dr. Bridgers on the latest COVID numbers and where we are with public health and plans for reopening our schools.
Thank you so much, Dr. Gales.
Good afternoon and happy Monday. I'm used to saying happy Wednesday from the city press briefings. Thank you for the opportunity to be here with you all today. Thank you, Councilmember Hucker, Council President Hucker, and Council Vice President Albornoz for your words of support. And thank you for the opportunity to work together. Again, as Councilmember Albornoz mentioned, before the pandemic and certainly through the pandemic, strengthening the infrastructure that was already in place and will no doubt continue to move forward and keep our residents safe. But to talk about the question at hand, the more important topic is where we stand related to COVID-19. The first thing I want to say before we talk about numbers is there's been a lot of attention on the ivermectin drug that some folks are taking. This is not FDA approved or indicated for COVID-19. Please do not take it. Do not take steps to go out and secure it. If you are experiencing COVID-19 symptoms, we strongly encourage you to get tested and to seek medical attention with a medical provider who will then help guide your treatment course. Again, please do not make efforts to obtain that particular medication, as it is not indicated and it is not FDA approved for the treatment of COVID-19. Now, that said, moving forward, we have continued to see, elevated levels of COVID-19 cases. In fact, over the last 4 weeks, we've seen over 3,324 cases. Now, fortunately, that has not translated into a comparable increase in terms of hospitalizations. In fact, of that over 3,300 cases, 138 of those have ended up in the hospital. Of the 3,300 cases, approximately 33% of those have been breakthrough cases, meaning cases in individuals who've been fully vaccinated, and that has translated into 36 of those 138 cases being hospitalized. When we look at the distribution of breakthrough cases, the majority of those cases, breakthrough cases, are happening in younger age groups. Particularly in the 20 to 29-year-old group, the 30 to 39-year-old group, and 40 to 49. Now, of those cases moving into the hospital, requiring hospitalization, that has trended and tended to be our older groups, being those who are over the age of 60. Most likely because of the presence of comorbidities or other conditions that require hospitalizations. Again, fortunately, while we do still see an occasional COVID-related fatality each week, we are not seeing levels of COVID-related fatalities that we saw at earlier stages of the pandemic. Now, I talked about this a little bit last week. This is suggestive and kind of gives us a little bit of a picture of what post-COVID life will look like, as we are likely to continue to see COVID cases in the community, but the question will be how many of those translate into hospitalizations and COVID-related fatalities. And as we move forward, hopefully the numbers stay where they are, particularly as we are introducing kids back into the school setting and we have such a significant population of the 0 to 12-year-olds who are not able to be vaccinated. As Councilmember Hucker mentioned, there have been lots of mitigating efforts put into place by our public schools and our non-public schools to ensure that kids can go back and return as safely as possible. And that includes making sure staff are vaccinated and masks are worn, again, to try to minimize any potential risk of exposure to those kids and children who are not vaccinated yet or not eligible to be vaccinated. Now, we are likely, I want to prepare folks at home, we are likely to still see some cases pop up in schools. We are likely to have some significant quarantines related to potential exposures. And I want to assure you that all of the steps that we are taking now in terms of contact tracing and contact investigation are consistent with everything we have done throughout the pandemic. The steps that we will take are not new. They are what we have had in place since last year. There are some nuances and we continue to tweak those processes as we get updated information from the CDC and the state level to guide those practices. So nothing that is being done is new. It's what we've had in place for throughout the pandemic. So rest assured, we are continuing to watch and continuing to make sure we do what we can to minimize any potential outbreaks in any of these particular school settings. Now, to help with that, we continue to have our standing testing and vaccine sites throughout the county. There are 3 sites that are county run where individuals can get tested and get vaccinated by appointment. We also have partnered with MCPS over the last week to at different schools throughout the county to have vaccination sites as well for staff and students who are eligible to get vaccinated before they return to school. We will continue to work closely with our colleagues, again, in the public school system as well as the non-public school system to provide guidance, again, to make sure that kids are as safe as kids, not only kids, but staff as well, are safe as possible within those respective settings. Now, the last thing that I would say is, as we continue to move forward, certainly we will continue to monitor the trends and offer guidance to the county executive and county council in terms of next steps to take. There will be, continued conversations about how we continue to create opportunities for reopening, particularly for those who are fully vaccinated, to make sure that they are able to enjoy the privileges of reopening, if you will, and be able to do that as safe as possible. And hopefully thereby encourage those who aren't vaccinated, who continue to make up the majority of new cases, the majority of hospitalizations, and unfortunately the majority of COVID-related fatalities. I will stop there. Dr. Bridgers, anything to add?
Thank you, Dr. Gales. A couple of points just to share. We began vaccinating, providing those 3rd shots for our immunocompromised individuals in the county. When it was last reported to us last week, we'd vaccinated 59 individuals, and we continue to monitor that. We aren't seeing a high turnout, but as you indicated earlier, we are advising those individuals who fall within that category to receive a 3rd shot to consult with their primary care provider to ensure that there's no counter indication regarding the 3rd vaccine, or if there are any complications due to their current medical treatment regime. The other thing, Council Vice President Albornoz touched on, talked about the power of our team, and we've included quality improvement processes in place. We've planned, we've done, we've studied, we've acted, we have all these systems in place as we look to our fall vaccination strategy with booster shots for those individuals. We've had conversations with our community partners, and we continue with our forward planning in the absence of any state guidance that we have. So we've crafted that platform that we've put in place. We've had 20 months to plan, and we didn't have a playbook, and we built our playbook, and we looked at the effectiveness of our strategy. And so we continue to look at that. We continue to provide it to council sitting as a Board of Health and the county leadership. As Dr. Gales indicated, we have the system in place, as we've done before, to not only test and vaccinate MCPS and our independent school systems, working with our hospital system and our other provider network. That's all I have, Dr. Gales. In addition to your update, thank you for the opportunity to share that.
Thank you, Dr. Bridgers. I think we are ready now to move on to questions from the media. Our first question today comes from Jordan Lindsay from MCM. She has questions for Council President Hucker and Dr. Gales. Jordan?
Thank you, Susan, and thank you, everybody. I just wanted to know regarding the vaccination and testing requirements for Montgomery County employees. Although there are reasonable options for employees, are there any consequences for people who might not want to comply?
Dr. Gales?
Well, that's, out of the purview for us as health department. That would be better answered by the Office of Human Relations. But I would encourage following up with them to get a full reading of the particular consequences that employees would face from the county should they choose not to get vaccinated. As it currently stands, employees will be required to get vaccinated or submit weekly tests to document their negative status.
Got it. Thank you. And then one more question regarding the booster shots. Can you elaborate? We did hear about the number of people that have gotten the booster shot so far in Montgomery County, but can you elaborate on just the goals that you guys have? Do you want everybody that's been fully vaccinated to get a booster shot in the future? What are your long-term goals regarding this booster shot? Can you elaborate on that, please?
Sure. Thank you, Jordan. So the first, I want to take advantage of this opportunity to kind of clarify some terminology. It is a little bit confusing how the different terms are being used. So when Dr. Bridgers mentioned that there were 59 individuals, we anticipate it's actually more than that. We were just reporting what has been done at the county sites is that those shots are considered third shots for individuals who have been identified who fit the immunocompromised category. And so for those folks, they're getting a third shot. And we've started that process. We're a week into that. And we hope that folks who fit into that category are following up with their primary care provider or their subspecialty provider who manages their respective condition and are able to receive the vaccine there. If they aren't, they're able to use the county sites in order to get that third shot. Now, the boosters are considered the third shot, if you will, for other individuals who don't fit into the immunocompromised category. Boosters will become available mid to late September, and we are awaiting further guidance from the federal government as well as from the state in terms of how to distribute those. At the time, the language has been put forward to suggest that individuals should get a booster shot 8 months following their second shot. There's been some recent chatter over the last week that that time period could be condensed from 6 months to 5 months. And individuals getting that, whether it's the third shot or a booster, should get the shot that is consistent with what they received for their first and second doses. So I received Moderna for the first and second doses. So my booster would be a Moderna shot. Now, because of the time frame that's been put on it, it will naturally kind of break down to how things were prioritized early on. If you remember, healthcare providers were part of that first group. So naturally, based upon time, it's likely that that will make up the largest cohort of that first group getting that booster shot. But again, that's something that will likely come on board in mid to late September. As Dr. Bridgers mentioned, we have been contingency planning for months now. And once we get further guidance from the federal level in terms of availability of shots, as well as information from the state, we will roll out those protocols and make them public.
Thank you very much.
Thank you, Jordan. Next, we have Rebecca Tan from the Washington Post. She has questions for the Council Vice President and the Council President. Rebecca?
Thank you. Quick question for Tom, just to clarify, the 50 social workers, Dr. McKnight said last week that it still needed to be approved by the state. Are you saying that it has gotten the approval and that the social workers are coming this fall?
No, only that they anticipate approval from the state. And
Okay.
the board president said to me today they anticipate in October.
Got it.
So
got it.
I think there's
Okay,
a little more
so
details we get every week, but they're not here yet. They're not approved yet, but they anticipate approval.
Got it. And for the council president and council vice president, will the council be meeting in person this fall?
We have polled our members, and with the surge in the variant, there's also just a logistical concern that our third floor hearing room where we normally meet is actually under construction still. So I think our understanding right now, based on the consultation with our staff and with the members of the council, is to continue to meet remotely, but to make some enhancements to allow us to have more than one committee meeting at the same time by making some technological upgrades.
Got it. Thank you.
Thank you, Rebecca. Next up, we have Kate Ryan from WTOP, who has several questions for our officials today. Kate?
Hey, yes, thank you very much. For the council president and vice president, did you both attend MACO, and did you have any concerns about the meeting structure and precautions about COVID at the MACO meetings? And then a second follow-up question for you both before I ask a question of Dr. Gales.
Did I have concerns? I attended MACO, and I know they put some precautions in place. I personally would have rather seen additional precautions, but it's a large and diverse organization.
Thank you. Yes, Kate, I did attend as well. I was there just for the day on Thursday, but I, like the council president, would have preferred to have seen a requirement for a mask mandate. But by and large, at least the meetings that I attended indoors, people were masked, and I did get tested immediately when we found out about the issue with the governor's staff, and came back negative, thank goodness. And I know a number of other county officials that attended also got tested as well. But it would have been nice for there to have been a mask mandate, and I think there should be moving forward.
Got it. Thank you both very much. And then a question about SROs. My understanding, and forgive me, I'm just back from a week away, so I'm playing catch up, but I have an indication that there were concerns from, I think, 12 school principals about removing SROs, that they actually want them back in the schools as a constant presence. Have you gotten any indication of this? And what would you say to principals who say, hey, I still want my SROs?
I personally, I haven't spoken to any principals about that. I am not aware of any correspondence we've received on that. I mean, there are a lot of principals, obviously, in the school system, and they do a great job, and it's not a surprise that they have a variety of opinions on the topic. There are an awful lot of principals that are aware of the many of the concerns about SROs as well. But anyway, the county executive and the school board have moved forward with this policy. So I think we're gonna, I hope everybody will, give it some time and continue to adjust it to make, to respond to the both the safety needs in our schools and outside our schools, and to hopefully avoid some of the downsides that we've experienced from SROs in the schools over the recent years.
Mr. Albornoz, your thoughts on that?
So I know that a number of principals testified when this issue was before the council in favor and in support of our SRO program. And so I know that some really dedicated officials, both within our Department of Health and Human Services, Montgomery County Police, as well as our members of our school administrations, have been soliciting feedback from just about everybody on this topic, that's going to be the most directly impacted by it. And they have devised a plan in place so that there will be officers patrolling the general areas of our high schools, and will continue to work on establishing relationships with the administrations of those schools, but they will not physically be present in the school. And the hope is that we alleviate some of the concerns raised by principals and parents as well about the school resource officers not being in the schools. But as the council president said, they are working through this transition right now. And our hope is that this is a seamless transition that continues to ensure the safety and security of everyone involved, and that we address holistically the mental health needs and the social and emotional needs, because the conversation regarding social workers is very much connected to ensuring that we provide robust support for our children, youth, and families.
Thank you. And a question for Dr. Gales and Dr. Bridgers. Do you all have a good sense of exactly what the plan will be should Montgomery County schools have a large number of kids who contract COVID? Are you satisfied with the plans that are in place? And Dr. Gales, on your way out the door, would you have any recommendations for them? Or again, do you feel confident in it? And what should parents know? If I'm a parent and I know that schools, send messages home to parents, they have a number of ways to communicate, but if you were to talk to parents about that, what would you tell them to ask, and what would you say that they should know?
Thank you, Kate, for your question. I think the first thing to emphasize is that, again, both for public and non-public schools, is that the leadership in both of those entities and throughout all of the schools have been working to develop plans and strategies for well over a year. We work closely with the leadership and again, both sets of schools to help provide guidance in terms of recommending the most up-to-date guidance related to safety protocols and mitigating procedures. And also want to remind parents at home, I know it's an anxious time right now, but to remind them that both sets of schools were able to return in the spring. And with a lot of these policies in place, fairly successfully, and we're able to close out the school year. So based upon the conversations that we've had with the respective leadership throughout the summer, they've continued to work to modernize and make sure their recommendations and protocols are up to date as best as possible. And I have confidence in what they have put forward in terms of their efforts to mitigate transmission as much as possible. What's also encouraging to me and from a public health perspective is not only have they done the due diligence to make their best effort to put in protocols, they've also indicated a willingness to be flexible and nimble to tweak those protocols to address any potential outbreaks or any particular change in terms of how the virus is impacting the schools and kids within that setting. And as Councilmember Hucker has already indicated, there was a pivot related to, where kids are eating lunch, again, offering outdoor spaces to be able to mitigate transmission as much as possible, given that during that time period, kids would be without face coverings because they've got to eat. So I am encouraged by that and encouraged by the leadership we've worked with, again, Dr. McKnight and her team and the respective leaders throughout the non-public school, the public school leadership as well. Now, we will see cases and we will see instances where we will need to have kids quarantine and get follow-up testing. And I want to, again, emphasize that the policies and approaches that we are taking to that and continue to take within that process are consistent with what we've done over the last year. They're consistent with the guidelines put forward by the CDC, as well as informed by the recommendations put forward by the State Department of Education and Department of Health.
Thank you. Dr. Bridgers, did you have anything to add or?
No, the only thing I'd like to add, Kate, is that in some instances that we have questioned some of the guidelines to make them safer when they come down. Dr. Gales and I have had conversations and we made those recommendations to ensure that we have those safeguards implemented. They follow the federal guidelines, and if state guidelines may not be as stringent as we've recommended, we've made them more stringent.
Thank you very much. I appreciate it.
Thanks, Kate. Our next question is from Marcela Rodriguez from Univision. She has a question for the Council Vice President. Marcela?
Hello, good afternoon. Thank you for having me. I would like to ask Mr. Vice President Albornoz a question in Spanish. Vicepresidente Albornoz, quería consultar si el condado contempla hacer el mandato de vacunación obligatorio entre estudiantes que participen en, por ejemplo, ligas deportivas, tal y como lo ha anunciado este lunes el condado de Fairfax.
Gracias por esa pregunta. Voy a responder lo que puedo, pero voy a preguntar a Dr. Gales y Dr. Bridgers que responden también. Dr. Gales and Dr. Bridgers, I'm going to respond to the first part of this question, but I need your help for the second part. The question was, are there currently considerations underway to mandate vaccinations for students that participate in athletic sports teams and leagues? Yo leí del incidente de los jugadores de fútbol americano en Quince Orchard High School la semana pasada, en que habían muchos jóvenes que consiguieron el virus. Y obviamente es importante que todos los estudiantes que están disponibles para poder conseguir la vacuna, que lo reciben, porque todos los estudiantes eran elegibles para recibir esa vacuna porque todos tenían más de 12 años. Pero lo que entiendo yo es que algunos de esos estudiantes no habían recibido la vacuna. Así que eso es primero, que jóvenes reciben la vacuna. Tenemos, en mi opinión, tener que evaluar y a ver si es una buena idea, porque creo que sí es una buena idea de que jóvenes, especialmente dos participando en deportes, que reciban la vacuna, porque no pueden tener distancia social cuando están jugando o están practicando. Así que, Dr. Gales, I know you speak a little bit of Spanish, so you probably picked up on some of what I said, but if you could elaborate from your perspective, that would be helpful. And I'll try to translate too for you.
Sure. Thank you, Councilmember Albornoz. And I did follow what you were saying. You know, unfortunately, I'm not skilled enough to respond in Spanish, but I followed. So I think the biggest question is, so from the perspective in terms of, at least from the health officer's office, in terms of our ability to mandate that, we don't have the authority to do that from the health officer's desk. The school systems, respectively, as it relates to those types of policies, as you know, some of that was changed last year. So the schools, as well as, if I recall correctly, from a legal perspective, the requirement of having the students vaccinated would need to come from the state level, the State Department of Education. And forgive me if that's incorrect, but that is my understanding. From the practical standpoint, in terms of requiring vaccinations, we actually require a host of vaccinations already. In order for our children to go to school. And many of us, particularly if we were products of the public school system, we were required to have vaccinations at regular intervals. We had vaccine passports. If you remember the vaccine cards that we used to have to carry and have to prove before we go back to school. So the notion of vaccine requirements is already present and already something that we enforce. I personally, as a practicing physician, do not see an issue with requiring the COVID vaccine, much like we require meningitis and measles, and there's just a host of other things that we require before children come back into the classroom. Because ultimately the goal is to keep folks safe. And the challenge in this situation, though, is we don't have a vaccine, or it's not available for those under the age of 12. And hopefully that will change soon. So summatively, in order to enforce that, that would have to come, it wouldn't come from the health officer, it would come from the state level, but it is not a bad idea in terms, particularly given we already have that requirement in place for a host of other vaccines to prevent outbreaks for those respective illnesses.
Sí, voy a repetir un poquito en español. Lo que dijo el doctor Gales es que lo que sabemos nosotros es que los oficiales de salud público al nivel local no tienen la capacidad de hacer esa regla aquí. Esa regla tiene que venir del estado de Maryland. Pero el doctor Gales sí dice que es una buena idea de que jóvenes, especialmente dos jugando en deportes, que tendrán que conseguir la vacuna para poder participar en esos eventos y en esas actividades, porque ya tienes que conseguir vacunas para otras vacunas para poder ir al colegio. Así que sería similar y piensa que es una buena idea. Y yo creo que es una buena idea también.
Excelente. Thank you so much.
Thank you, Marcela. Our next question is from Heather Curtis from WMAL Radio. She has questions for the Council President. Heather?
Hi, thanks so much for having us today. Council President Hucker, you spoke a little bit about and Council Vice President Albornoz, both about the social workers. I'm wondering, if you could just elaborate on the importance of those. And there are a lot of kids now who are really anxious and struggling because they haven't been back to school in person until today, since before the pandemic started. So I'm wondering at this point, what would your advice be to parents who are dealing with kids who have a high level of anxiety going back to in-person learning?
Encourage our public health team to chime in as well. I mean, it's my view that we haven't had the resources in place, in our school system to deal with our behavioral health needs, well, both inside and outside our school system for years pre-COVID. And unfortunately, now with the isolation, anxiety, and just we've lost 1,500 plus residents, and so many of our young people have lost family members during this period and are dealing with grief and loss and anxiety and isolation, and not seeing their friends, not being able to learn in public in person for a very long time. So we don't. I haven't talked to anybody who feels like we really even know what's out there yet. And so I think it's great that the school system is moving in this direction. I, had, like, as I said, wished anything that this had moved more quickly. But I would encourage parents to get in touch, certainly with their principals and our HHS department, to get in touch with the behavioral health resources that we have at the school system level and the county level.
Yeah, I'll just add really quickly that I totally agree with everything the council president said. There are services in place through linkages to learning, through guidance counselors at schools. There are nonprofit organizations that provide immense support services. And so these 50 social workers that will be added to our school system will join an already really robust and strong network of mental health providers and make it even stronger, because we know that these social workers are almost on day one going to receive a significant caseload that for them to be able to appropriately address is something that's going to be part of this broader system that has to be in place. And so hiring these social workers is so critical, onboarding them is so critical, but ensuring that there's a seamless network of referrals is also going to be really important here. And we are seeing, and we have seen, there have been numerous council sessions on this, both in the HHS committee and in the education and culture, alarming rates of mental health challenges that are rising to the clinical level. And so we have to continue to have this robust network in place. And frankly, for parents and support staff as well, who are exhausted, who are overwhelmed in some instances. And so we need to make sure that we address the mental health needs of our students primarily, but also everyone that's providing them support as well.
Thank you so much.
Thank you, Heather. Next, we have Steve Bunnell from the Bethesda Beat with questions for our officials. Go ahead, Steve.
Thank you. Just following up actually on what Rebecca was mentioning, Tom, is it more of the construction at this point that's delaying you from coming back, or is it the spread of the Delta variant? Because, as you know, the Board of Education's just started reconvening in person. I'm pretty sure the planning board is planning to. I just want for you to follow up on that, I guess.
Sure. I mean, the construction's a significant factor. And if I remember right, I thought we'd be farther, like many construction projects, we thought we'd be farther along now than we are, unfortunately. And just about every construction project, many of them have been delayed due to COVID as well, and availability of workers and contractors. But I'll check on that. Certainly that's a major consideration. And we want to do what we can to, to follow good practices. The good news is, not knowing how this would work out at the beginning of COVID, we've had more participation in our public hearings over the last year than we ever did, during COVID or previously. We've worked through a lot of technological challenges and taken an awful lot of testimony via Zoom and through other platforms. And I do feel like we're doing a good job of hearing from the public on all kinds of hot topics. But we're going to return to in person as soon as possible.
So if not September 14th, any sort of sense, or is it just, I'm going to say a month, the 2 months? I know you probably can't give me a date, but
I'd have to check with our staff. I think right now our understanding is we'll meet remotely as we have been through the fall, and I'll check on the construction schedule.
And Steve,
sorry, go ahead.
I want to also mention, I think it's worth noting, the council president is in his office right now. Right. I'm in my office right now. So, and my colleagues are regularly coming into the office and have staff coming into the offices as well. And we will be, after Labor Day, able to host meetings in our offices, of course, adhering to all the CDC guidelines with mask use, clearly. But just because we're not going to conduct our hearings publicly right when we had originally anticipated, I just want to make clear that that doesn't mean that the council is working virtually across the board. And so as we transition back into this and the construction's complete, we will be in a better position at the end of September to reevaluate everything.
Right.
All true, and I'll just chime in again. Now that Gabe triggered my recollection of this point, which I think is important. I've been an advocate for more support to get greater diversity of our residents to be able to participate in public hearings for quite a while. And one unexpected sort of consequence of taking testimony by Zoom is that we also not only have more people testifying, we have a greater diversity of our residents testifying, because a lot of parents that are home with kids after and not able to show up in person, a lot of people who do not have the ability to hop in a car and drive to Rockville can now testify via Zoom, which is I think has been a great thing for all of us in office, because we're hearing from a greater diversity of our residents than we were when we were just requiring in-person testimony.
I just wanted to clarify, you said that they're working on logistics to have committee meetings at the same time. Can you just expand on that a little bit?
Sure. I'm not an expert on this, but one of the problems was using only one platform. We couldn't broadcast council hearings, multiple ones at the same time. So we couldn't have two committees meeting at the same time. And I think we've moved past that now, where we'll be able to have both the cable broadcast of the committee and use multiple internet platforms to take testimony.
And
that's my understanding. I'll try to confirm that, but I haven't been working on this myself, but it seems like a solvable problem that our staff have been working on.
This one's for Dr. Gales. Obviously, as kids come back, I hear things and read things about, with the Delta variant spreading, that how much these variants are going to impact kids. I'm just curious what you and Dr. Bridgers have seen the latest from the literature. A lot of people hear and tell me that, kids are probably gonna be okay, but I don't follow the studies every day. So.
Thank you, Steve, for your question. So the reality is, you're right. So in the early stages of the pandemic, many folks were under the assumption that, well, if kids get it, they will be okay. And for the most part, that was true, not 100%. And that was when we were dealing mostly with the novel strain. We were only able to really find that out until well into things that, provided that hindsight. The challenge with the Delta variant is that we are seeing more pediatric cases ending up in the hospitals and requiring critical care services. In fact, if you look at a host of the states that are being hit hardest by the Delta variant right now, Arkansas, Texas, Florida, Mississippi, you are seeing significant burden in the pediatric hospitals, and a good amount of those cases ending up in the critical care units. And as a result, in fact, I believe it was just yesterday, the leadership of all of the children's hospitals across the country submitted a uniform letter requesting folks to do what they can to make sure we protect our children. And I would encourage you, the article I read was in the New York Times that referenced it, but I'm pretty sure it's probably available. So I would encourage you to take a look at that because we know that we need to protect our children who can't get vaccinated. And in order to do that, it requires us as adults to get vaccinated, to put in policies that will keep them and protect them, whether it's face coverings or, implementing physical distancing within spaces to make sure we keep them as safe as possible. So in summary, we have seen the Delta variant impacting children much more than we saw with the earlier versions of COVID-19. And we're unfortunately seeing kids requiring critical care and unfortunately passing away. So it's important that we don't just assume if a kid gets it, they will be entirely fine. That would be a huge mistake. And it underscores why we're putting forward and recommending all of the actions and efforts we can to mitigate transmission as much as possible.
Do those kids that have unfortunately gone to the hospital, but do they have comorbidities or any other extenuating circumstances what's the picture there?
I can't comment on that because I don't have access to the data in those respective states. I would imagine it's a combination of particularly, obviously, anyone, whether regardless of their age with significant comorbidities, is at significant risk of having a worse outcome if they were to contract it. But what's also really telling is that we're seeing an uptick in the number of cases in the extremely young, so infants and toddlers. And that suggests that it's less about comorbidities for that population and more of, if you think of it in layman's terms, their systems just not being sophisticated and mature enough to be able to handle such a powerful virus. And, you know, so we've got to be very careful again, not to assume that just kids who have comorbid conditions or are immunocompromised or at risk. It is still hitting otherwise healthy kids, hitting them just as hard as some of those other cases.
And I guess, you know, obviously, like you've said multiple times in previous weeks, hospitalizations aren't high yet. I mean, is there a number that, you know, if we hit a certain level that you're really looking at, okay, we might need to start re-implementing some more precautions, or is it?
Well, we would be, you know, we would look at the numbers, the hospital measures that we've consistently looked at throughout the pandemic, including total bed usage, critical care unit usage, as well as staffing to bed ratio. We would also be looking at, you know, the percentage of hospitalizations related to COVID to see if any of those, you know, numbers started to increase. And we haven't seen that yet here. And I want to emphasize but the major reason why we're not seeing that here is because we have a high percentage of our residents vaccinated. And when you look across the country, when you see the communities that are being hit hardest by the significant increase in hospitalization, it's driven in large part because they have such low vaccination rates. And so I want to take this opportunity to commend our residents, commend everyone who has worked to get our residents vaccinated, whether it's standing up clinics or providing outreach, because that is truly what's providing the biggest buffer for us. That's protecting us, even though the cases are going up, but it's protecting and keeping us from being in Arkansas, Florida, or Texas right now. And I hate to have to use those states as examples, but they are clear examples where when you have low vaccine rates, you're seeing them being hit hard by Delta variants, which translates into increased hospitalizations and increased COVID-related fatalities.
No, thank you, everyone.
Thank you, Steve. That wraps up all of our questions for today's media briefing, gentlemen. Thank you very much to all.
Oh, wait, sorry, I had a question. I'm so sorry. I sent my request to Councilman Albornoz by mistake and not the entire group. It's Corey Smith of WRC. Do you mind?
Sorry, Corey.
No problem. It's totally my fault. I sent the message to the wrong person. Sorry, Councilman Albornoz. But yeah, quick question for Dr. Gales and Dr. Bridgers, and then for Council President Tom Hucker. Dr. Gales and Dr. Bridgers, just given the work that you all did with MCPS, would you anticipate or would you be surprised if a building did have to close due to too much spread of COVID?
Hi, Corey. Thank you for your question. I just want to emphasize that even in the best efforts, we do expect that there are going to be some cases and some exposures in schools. Now, the scale and scope of the investigations and quarantines, we feel will be minimized due to the mitigation efforts that are put into place. But, you know, as you recall, when schools opened in the fall last year, we did have a significant number of investigations that required follow-up, and in some cases required a number of students to be quarantined. I think in rare situations that we have to close an entire school, I think it was mostly contained to a small number of classrooms or smaller units. But certainly if we find in our contact tracing team, and we find that there is a larger level of exposure, we would have to take that level of action. We're hopeful, though, that given the mitigating protocols that are in place, that you know, any potential outbreaks or exposures will be kept at a smaller scale.
One quick follow-up on that, and then a question for Council President Hucker. Are you all involved in any sort of direct conversations with MCPS in terms of, say, for example, the Quince Orchard football team? Are you all involved in any sort of decisions in terms of, hey, you need to shut this program down, this sport down, because there just simply are too many cases, or is that a decision that is left up to MCPS?
Well, consistent with how contact tracing has been done, again, throughout the pandemic, is when it gets to an issue of there being an exposure, potential isolation or cases in quarantine, the guidance related to that is the responsibility of the public health services team and our contact tracers and disease control unit. And so if there is a point where there would need to be further action taken, that would be guidance provided by us. And those recommendations would be put into place because it is less about a school issue and more of a public health issue that affects the entire community. So yes, if something like that happens, consistent again throughout with what we have followed throughout the pandemic, we would provide the guidance and recommendations on the necessary next steps that would need to be taken.
Great. And then lastly, Council President Hucker, I guess as a council president and as a parent, we've heard a lot of talk throughout the region about some parents wanting this sort of contingency plan. You know, if things get bad, we want the school district to be able to pivot and offer, virtual options. Within Montgomery County's contingency plan, though, they have said we will not shut down buildings and go to district-wide virtual learning unless the state requests it. Given that Montgomery County and the state have not particularly seen eye to eye when it comes to things like reopening and decisions being made, are you comfortable with that? Are you comfortable with MCPS saying we're going to leave it up to the state to decide whether or not we can or should shut down our buildings and move system-wide virtually?
That's an interesting question, Corey. I don't know the decision-making that went into that and the considerations. I think I'd want to get more information from them before I take any issue with their decision. But I think we're pretty far from that at this point. So I think we have a little time to consider and reconsider it.
All right, thank you.
Sure.
Okay, thanks, Corey. That's going to wrap it up. Gentlemen, thank you so much for being with us. Thanks again to the members of the media who joined us, and have a great Monday, everybody.
Thank you all.
Recording stopped.